Good morning, everyone. My name is Kenny Wu, and I'm the program coordinator here at Cornell CTSC. Thank you, everyone, for joining us today on our presentation on Parkinson's today. And we're joined by Natalie Holmers and Mesa Trabelsi from the Department of Neurology and Movement Disorders Division at Cornell Medicine. This presentation will be done in English and Spanish. If you want to ask any questions or you want to talk to the presenters, there's a chat function at the bottom of the screen. You can type in a question and the presenters will answer the question during the Q&A section of the presentation. At the end, we will also have a short poll about today's presentation. It's going to be anonymous, so please fill it out if possible. And I'll do in Spanish. Muy buenos días, mi nombre es Kenny Wu y yo soy el coordinador de programas en Cornell CTSC. Muchas gracias a todos ustedes por atender a nuestra presentación el día de hoy. Vamos a tener una presentación sobre Parkinson's. La presentación va a ser en inglés y en español. Si tienen preguntas en la parte de abajo, hay una sección para preguntas Q&A, chat. Las presentadoras del día de hoy son Natalie Holmers y Maisa Trabelsi del Departamento de Neurología de Cornell Medicine. Al final, vamos a tener una encuesta sobre la presentación. Por favor, llénenla si pueden. You can start.
Okay, thank you so much. I'm so delighted to be able to do this morning. And Kenny, thank you for making it possible. So we begin our introduction to Parkinson's disease and clinical trials.
La presentación va a ser una introducción a la enfermedad de Parkinson y los estudios clínicos. Listo.
And so presenting here today, myself, I'm a nurse practitioner. My name, for those of you who don't know me, is Natalie Helmers. And a fun fact about myself is that I was an ICU nurse before switching gears and dedicating my career to neurology, where I am now in the outpatient neurology clinic at Weill Cornell. And I turn over the microphone to my wonderful co-host here.
Hi guys, so my name is Mesa Trabelsi. I am a research coordinator that works with Natalie and the rest of the Parkinson's disease department at Cornell. I am a aspiring physician. So I do hope, to go to medical school soon. And a fun fact about me is that my favorite TV show is The Office.
Conoce a tus presentadoras. El día de hoy tenemos a Natalie Helmers, una enfermera, y sabías que fue enfermera de ICU antes de dedicar su carrera a la neurología. Y también tenemos a una coordinadora de investigación, Mesa Trabelsi. Es una aspirante a estudiar una carrera en medicina y su programa favorito de televisión es The Office.
As we begin our objectives, I also wanted to give a little shout out to our patients and research participants who have been joining us virtually since the pandemic began. And so just a little reminder, this is a slightly different format. We are recording the presentation, so for those of you who want to watch it again, we'll be able to share it with anybody who couldn't log in live. And the questions, of course, will come at the end. So normally when I begin this, I say, interject whenever you want. This time we'll have the questions at the very end. So that was just a little friendly reminder. So our objective here today is to include the background information of Parkinson's disease and some possible causes, history, and symptoms. And we'll segue into a summary of our studies at Weill Cornell.
Los objetivos del día de hoy, una introducción a la información de antecedentes sobre la enfermedad de Parkinson y un resumen de todos nuestros estudios en Weill Cornell.
So to begin with an overview, of Parkinson's disease. It is a progressive nervous system disorder that leads to both motor, movement, and non-motor symptoms. And so you'll hear the words motor and non-motor quite frequently. With Parkinson's disease, symptoms start gradually, usually as a tremor, though not always, and this can worsen over time. And on the screen here, we have the famous Michael J. Fox, who really has been such a pioneer in research advocacy for Parkinson's. And this quote, "I don't have any choice whether or not I have Parkinson's, but surrounding that non-choice is a million other choices that I can make." So very, very inspiring quote from the famous Michael J. Fox.
Lo primero que vamos a hacer, vamos a dar una visión general de la enfermedad de Parkinson. La enfermedad de Parkinson es una enfermedad progresiva del sistema nervioso con síntomas motores de movimiento y no motores. Los síntomas comienzan gradualmente, generalmente como un temblor, y empeoran con el tiempo. En la parte de abajo, un dicho de Michael J. Fox: no tengo elección acerca de si tengo o no el Parkinson. Pero en torno a no tener elección, hay 1.000.000 de otras elecciones que puedo hacer.
We talk about the possible causes of this disease, and we could have a lengthy conversation about this part alone. What we do know in Parkinson's disease is that neurons in the brain gradually break down or die. And many of the symptoms are due to a loss of neurons that produce a chemical messenger in your brain called dopamine. So you'll be hearing a lot about dopamine when we talk about Parkinson's. And when dopamine levels decrease, it causes abnormal brain activity, leading to symptoms of Parkinson's disease. And we have this image here where we can see deep, deep, deep into the midbrain. We have the area called the substantia nigra, the putamen, and in there is the dopamine pathway that is so important for so many different things.
Posibles causas de la enfermedad de Parkinson. En la enfermedad de Parkinson, las neuronas en el cerebro se descomponen o mueren gradualmente. Muchos de los síntomas se deben a una pérdida de neuronas que producen neurotransmisores llamados dopamina en el cerebro. Cuando los niveles de dopamina se disminuyen, esto causa una actividad cerebral anormal que en torno causa síntomas de la enfermedad de Parkinson. Estos neurotransmisores son biomoléculas que tienen la misión de transmitir o alterar la transmisión de información.
So overall, the causes are unknown, but we do know that several factors appear to play a role. And this includes genes or genetic makeup, our age and sex, combined with environmental triggers. For example, toxins. And there was actually an article in the July, I believe it was the 20th of July in the New York Times, that talked quite a bit about toxins. So it's timely that we are discussing this now. And these causes, so causes combined, can lead to deposition of abnormal amounts of a protein that's normally produced called alpha-synuclein, right? So it's normal in the brain, but the combined causes seem to trigger a detrimental effect that is the cause of Parkinson's.
Otras posibles causas de la enfermedad. Hay muchas posibles causas de la enfermedad. No sabemos las causas, pero varios factores deben ser considerados. Por ejemplo, tu genes, edad y sexo. También desencadenantes ambientales como la toxina. Estas causas pueden conducir al depósito de cantidades anormales de una proteína producida normalmente en el cerebro llamada alfa-sinucleína.
Sorry, I moved that a little too quick there.
That's okay.
Thank you, Kenny. So I thought it would be fun to talk a little bit about the history of Parkinson's disease. Some of you may know it was James Parkinson's, right, whose name actually put the name on the illness itself. 1917, we have Parkinson's disease first identified by keen observation by James Parkinson. He kept steady notes on what he observed. And so he referred to the condition originally as the shaking palsy. Imagine that 2 years later, Konstantin Tretyakov, during the time of the Spanish flu, we think about we are in the time of a pandemic now. So during the Spanish flu, he was working on post-epidemic encephalitis brain autopsies and actually made the association in those brains on autopsy that the dopamine cell loss existed in part of the brain called the substantia nigra. And so it was actually in 1919 that the substantia nigra, right? Everybody saw the image on the previous slide that put that landmark area that we know if there's dopamine cell loss there in that region, that particular region of the brain, it can cause the motor symptoms that we see in Parkinson's disease. Jumping forward to the 1980s, Dr. Stanley Thon and colleagues published a rating scale, again, something that's based on keen observation of movement. And this helped to quantify progression of the neurological illness and also serve as a tool for providers to help track changes over time and also changes from possible intervention. So intervention like medication or exercise. By 1992, the principles of clinical diagnostic protocols of Parkinson's disease were further developed and published by Hughes and colleagues and advanced in 1999 by Gelbs and colleagues with MRI imaging to rule out alternate diagnoses. And then in 2011, we have the FDA, which is the Food and Drug Administration, approve imaging tests to help rule out essential tremor for Parkinson's disease. So we're finally moving into an area where we actually have some kind of imaging that we can distinguish Parkinson's from other vascular movement disorders. So you can see the chronology and timeline of some of the history here.
Un poco de historia sobre la enfermedad de Parkinson. En 1917, la enfermedad de Parkinson se identificó por primera vez por James Parkinson y describió la condición como parálisis agitante. En 1919, el neuropatólogo Konstantin Tretyakov, I believe that's his name, descubrió la pérdida de dopamina en la zona del cerebro llamada sustancia negra mientras trabajaba en autopsias de cerebros con encefalitis. En 1980, Stanley Fan y sus colegas crearon una escala para medir la progresión de la enfermedad neurológica y para servir como herramienta para proveedores para monitorizar cambios a lo largo del tiempo y cambios de posibles medicamentos. En 1992, los principios de los protocolos de diagnósticos clínicos en la enfermedad de Parkinson se desarrollan y se publican. Estos principios son extendidos en 1999 por Gelb y sus colegas con el uso de imágenes de resonancia magnética para proveer diagnósticos diferenciales y descartar otras posibles condiciones. Entonces, en el 2011, la Administración de Drogas y Alimentos de los Estados Unidos aprobó un examen de imagen para ayudar a descartar el temblor esencial de la enfermedad de Parkinson y otros trastornos de movimiento.
And so to review, the motor symptoms of Parkinson's disease. And there are three main major motor symptoms, right? So we have tremor, which is an involuntary movement. We have bradykinesia, which is a fancy term to say slower movement. And also rigidity, where we have stiff muscles, stiff limbs. And so again, when you hear the word motor, we think of movement. And then looking at the image here on the right, we also know that in Parkinson's, we can see posture changes. So a person might present with a more stooped posture. We have a masked face, which is also referred to as a flat affect, where the face might become a bit less expressive. One's back might become rigid. The upper arms may also become flexed and stiffer. With the stooped posture, there can also become like a forward tilting of the trunk. Reduced arm swing, in some cases, that is one of the first signs that may present, that while a person's walking, one arm might swing less than the other. They might notice it, or they might not even notice it. Hand tremors can occur. There could be less reduction of a hip and knee flexion, or just basically less reduction of the movement. So the movement can be slower, right? That's bradykinesia as we know it, or stiffer, or both. And there can also be tremor in the legs. So tremor can actually exist anywhere in the body. Quite oftenly, it'll just start on one side, whether it be the arm or the leg. And there can also be shuffling. So the steps get shorter, a bit closer to the ground. The feet don't lift as high as they would otherwise.
¿Y cuáles son los síntomas motores de la enfermedad? Temblor, movimiento involuntario. Bradicinesia es lentitud con disminución en la amplitud de movimiento, músculos rígidos y complicaciones motoras. Aparte, también tenemos alteraciones de postura, la marcha y el equilibrio, y hay pérdida de movimientos automáticos.
And so with the motor symptoms of Parkinson's, we can see impaired posture and balance. There might be loss of automatic movement, speech changes, so the voice may get softer or lower. There may be writing changes as well. So very commonly, a person may say or notice, oh, wow, my writing has gotten smaller. I don't write quite as big as I used to. Or perhaps if the handwriting was neat at one point, it's not as neat as it used to be. So that can be a possible motor sign as well. Again, not everyone, right? So in some cases, a person's handwriting still might remain intact. That is, of course, if you are still writing, since many of us have just switched over to typing and texting for almost all of our communication nowadays. And if you look at the image on the right, so again, just to sort of reiterate, the tremor can be in the head. There can be speech where it's not as clear or distinct. There can be weight loss. And perhaps we'll talk a little bit about that as we get to our later slide. And just to reiterate, right, the stiffness or difficulty in the muscle movements. There can be constipation or urinary incontinence. That's the non-motor aspect of symptoms. And as we said, the inclination, leaning forward of the head and the body, hand tremors, and in some cases, trouble with swallowing. Again, this is not universal. So just because the symptoms are listed here, if it's yourself or someone you know with Parkinson's, it doesn't necessarily mean that all symptoms present themselves. So it could be, one of several, it could be a few of them, and this varies so much person to person.
También hay otros Posibles síntomas motores de la enfermedad, como por ejemplo alteraciones de postura, marcha y equilibrio, básicamente inestabilidad postural, pérdida de movimientos automáticos, deterioro del lenguaje, cambios en el habla y cambios en la forma de escribir. En la parte derecha hay una figura. Otros ejemplos son temblores en la cabeza, pérdida de peso, constipación, temblores en la mano y problemas tragando al comer y cuando tomamos agua.
So there are 5 stages of Parkinson's disease. Although if anybody comes to our clinic at Weill Cornell, they may learn very quickly that we actually don't use staging in the clinic, but staging in research takes on sort of a different level of significance. So the stages, we'll explain to you here, range from 1 to 5, from mildest to most severe. And while we know Parkinson's disease currently doesn't have a cure yet, medications can significantly improve motor symptoms so that, you know, a person might shift to a stage 2 or 3, and with proper medication can scroll back, you know, from 3 to 2 or from even 2 to 1. In some cases where proper medication as well as physical therapy, exercise, and really a lifestyle change can make those symptoms very, very mild. And then in some cases, if symptoms do become severe and medications don't help, the neurologist may suggest a surgery to help with the abnormal movements. So again, just a summary for you all here this morning. Stage 1, so we have minimal symptoms, unilateral, so a symptom may appear only on one side. Stage 2, we can see both sides affected, right? So where maybe a tremor started on one side, we see the tremor on both. Maybe rigidity started on one side, we now feel rigidity on both sides. With stage 3, we can see balance being affected. And that sort of change, again, would indicate that shift towards the next stage. In stage 4, a person may need help with daily activities. They can no longer do things on their own. And stage 5 is the more severe symptoms where there's very significant motor impairment.
Hay 5 etapas de la enfermedad de Parkinson, desde la más leve hasta la más grave. Aunque la enfermedad de Parkinson no se puede curar, los medicamentos pueden mejorar significativamente sus síntomas motores. Ocasionalmente, su neurólogo puede sugerir una cirugía para los movimientos anormales. También le vamos a dar un resumen de las 5 etapas. La primera etapa son síntomas mínimos unilaterales, una parte del cuerpo. La segunda etapa, los 2 lados del cuerpo son afectados. La tercera etapa, el equilibrio es afectado. La cuarta etapa, las personas necesitan ayuda con actividades cotidianas como cocinar, bañarse. Y la quinta etapa son síntomas graves.
And so, you know, to segue onward to the diagnosis, keep in mind it's still a clinical diagnosis. While we're getting better with our imaging, while we are looking for biomarkers, the diagnosis is still on a clinical basis. All right, so a person has their medical history evaluated, all the signs and symptoms reviewed, a full neurological and physical exam, and then of course, if you know the information or the history is a little questionable and the diagnosis isn't always quite so sure, imaging may be used in addition. And in some cases, it may take some time to actually diagnose Parkinson's. And of course, we know this can be very frustrating to someone. And you know, quite often it's simply a matter of watching, observing, and seeing what else may reveal itself. And so that's where the importance of letting that time pass a little bit to see what changes and then what actually doesn't change. And so here below the image, again, is a review of all those symptoms, right? Those primary symptoms that make the clinical diagnosis.
¿Y cómo se diagnostica la enfermedad? Es un diagnóstico clínico. Se basa en su historial médico, signos y síntomas. Aparte, se da un examen neurológico y físico y un diagnóstico por imágenes. Diagnosticar esta enfermedad puede tomar tiempo y en la parte de abajo es un resumen de la enfermedad, ¿no? ¿Cuáles son los síntomas mayores o los síntomas que se producen usualmente y los síntomas secundarios?
At this point, regarding treatment of the disease of Parkinson's disease, there are many medications. There's carbidopa-levodopa and many types of carbidopa-levodopa. We have our various dopamine agonists, which come as oral tablets and also a patch. We have MAOB inhibitors. We also have amantadine. And then, like I mentioned before from the other slide, if in fact symptoms start to become complicated, or if a person is struggling with issues with medications, you know, maybe the medication doses have gotten a little bit higher and side effects are now becoming more and more apparent, then surgical correction, surgical procedure known as deep brain stimulation, or DBS for short, right? Because it's a mouthful and we like to shorten things in medicine and science. So DBS might be the possible form of treatment. And again, when we talk about those different stages, it's wonderful when a person has symptoms and now those symptoms can actually regress. And so with the deep brain stimulation, some of those motor symptoms can be better controlled. And of course, the lifestyle and home changes, which are incredibly important. We can't emphasize those enough. And because there is no cure, and because we still need to understand so much more about Parkinson's disease, we need clinical trials. And so this is where we come in, and this is really our focus for today, to talk about these clinical trials and why they're important.
¿Cuáles otros tratamientos para la enfermedad? Medicamentos como la carbidopa, levodopa, agonistas de dopamina, inhibidores de MAO-B y la amantadina. También hay cirugías como la DBS y también cambios de estilo de vida y el hogar, como los ejercicios aeróbicos. Y aparte de eso, también hay estudios clínicos o ensayos clínicos.
To say a little bit, oh, I will not be able to, yes, I can, okay. Pardon me, I thought my screen was stuck. To say a little bit about the exercise. And again, this is so, so, so important. We know through research, this is evidence-based, that exercise training not only improves muscle strength and function, but has multiple benefits for the human body. Right, so it reduces motor symptoms. It can improve bradykinesia or slowness, as well as postural instability. Right, so when we talked about balance and the issue with balance and leaning forward and not being able to keep one's balance, exercise is everything for that. Medication will not will not help nearly as much as proper exercise would. And exercise also enhances the efficacy of levodopa therapy. It's not enough to just take the medication. You really have to put the work and effort into it. This improves one's endurance. It also can improve gait disturbance. So if a person has walking issues, exercise can go a long way. We also know from research that exercise improves cognitive function. We know people are better test takers when they exercise. And overall, it improves the quality of life. So again, we cannot emphasize this slide enough.
Otra forma de tratamiento para la enfermedad de Parkinson son los ejercicios aeróbicos. Los investigadores han descubierto que aparte de mejorar su fuerza muscular y su función, el entrenamiento físico también tiene estos beneficios. Reduce los síntomas motores, mejora la bradicinesia, los movimientos lentos y la inestabilidad postural. Mejora la eficacia de la terapia con levodopa, mejora la resistencia, mejora las anomalías en la forma de caminar, problemas para caminar, mejora la función cognitiva y aparte de eso también mejora la calidad de vida en general.
When we talk about the treatment of Parkinson's disease, a change in diet can also go a really long way. And some of you might have heard this or read about this. Officially, there isn't a quote unquote Parkinson's disease diet. However, the evidence that is out there really leans towards this here, the Mediterranean diet. So for those who can see the screen, and we are looking at the pyramid, so we emphasize vegetables and fats like olive oil, smaller amounts of lean protein, which includes chicken or fish, certainly moving away from a lot of red meats and processed foods, which are thought to be most likely the most hazardous on the body. More fruits, nuts, grains, and beans. You know, in moderation, alcohol, small amounts, and water, enough hydration, which quite often, believe it or not, many people walk around and don't even realize that they are dehydrated. And oftentimes when those symptoms actually start to appear and make a person feel unwell, they are really, really dehydrated. So water has a big role in this picture.
También la dieta. Aquí, por ejemplo, la dieta mediterránea, más verduras y grasas como el aceite de oliva, pequeñas cantidades de proteína magra o proteína sin grasa, incluyendo el pollo o pescado, y más frutas, nueces, granos y frijoles, y claro, ¿no? Tomar más agua.
Alrighty, so this is where I'm going to take over. So thank you, Natalie and Kenny, for that wonderful background of Parkinson's disease. So basically, clinical trials. Clinical trials are scientific studies conducted to find better ways to prevent, screen for, diagnose, or treat disease. They produce data for future healthcare decision-making. Next slide, please.
Investigaciones en el área de enfermedades neurodegenerativas, que son los ensayos clínicos o los estudios clínicos. Los ensayos clínicos son estudios científicos realizados para encontrar mejores formas de prevenir, detectar, diagnosticar o tratar enfermedades, ¿no? Producen datos para las decisiones de atención médica en el futuro.
So at our department here at Cornell, we have multiple clinical trials running focused on all stages of Parkinson's disease. So as Natalie stated earlier, there's 5 stages, stage 1 all the way to stage 5. We have clinical trials spanning, the range of Parkinson's. So I'm sure if someone is interested, there will be a good clinical trial fit for that person. And we are also located on 428 East 72nd Street, Suite 400 on the Upper East Side. And we, it's very easily accessible by subway, by bus. All right, next slide, please.
¿Qué estamos haciendo el día de hoy? En la clínica de trastornos de movimiento tenemos múltiples estudios y ensayos clínicos en ejecución, enfocados en todas las etapas de la enfermedad de Parkinson.
All right, so our mission, we provide interested patients with the opportunity to participate in developing a better understanding and treatment of Parkinson's disease. So there is ongoing trials in conjunction with other research centers that also provide the options for patients to try new study drugs, new interventions. And we also have the option as well of participating in observational trials. So if something like study drugs and new interventions are not, a good fit for you, and you just, want to add to the betterment of the Parkinson's disease community, you could definitely participate in trials in any observational trials. All right, next slide. We are compassionate and we and comprehensive in your care. If you have Parkinson's disease and are experiencing symptoms that are not responding to your current medications or any current treatments, clinical trials may be the appropriate decision for you. So, if you're frustrated and if you're not seeing any benefit from your current treatment plan, clinical trials may be the good fit for you. So we'll expand more on the clinical trials that we have running at Cornell. Next slide, please.
I'm just going to interject for 1 second. Esta parte de la presentación solo va a ser en inglés, no en español.
All right, so let's begin with the overview of all the protocols that we have running at Cornell. I'm going to start with early PD disease modifying trials, the first one being SPARK. SPARK is a double-blinded study. Double-blinded meaning the subject is not knowing what type of treatment they're receiving, as well as the investigator. So both sides of the study, the subject and the investigator, they do not know what type of treatment they are getting. Okay, to determine the ability of a study drug, the study drug's name is K0706, to slow down the progression of Parkinson's disease, as well as to determine the safety of K0706. So these are the criteria for anyone that is interested. You have to be over the age of 50. The study period, so the course of the clinical trial is 44 weeks. And subjects that are interested, they need to have a diagnosis of PD within 3 years. And this is the very key criteria of this trial. You need to be naive to any type of dopamine treatment within 9 months of first visit. So for this particular trial, we are looking for patients that are recently diagnosed with PD, that do not have a current treatment plan. All right, and then this protocol does include some imaging. So more precisely, it includes the MRI scan, and it includes a DAT spec and some specimen collection like blood, as well as possibly being put into a biomarker sub-study, which will involve a lumbar puncture, which is the collection of CSF. All right, next slide. All right, so this, I'm going to move on to a protocol for people already on medications. It is called Restore. And this study is basically to evaluate the durability of the effectiveness and safety of a study drug called droxidopa in people with systematic neurogenic orthostatic hypotension, so for short, NOH, which is basically a low blood pressure causing tiredness, dizziness, and muscle aches. So this one is more inclusive, so you could be over the age of 18. So, that would, definitely widen the study population. The study period is 36 weeks. You must have a diagnosis of NOH with Parkinson's disease. There is no medication requirement. So this one is a bit more inclusive, as I said. It's more inclusive of patients currently on treatment. I think there's specific medications that might exclude you, but those exclusionary medications are very few, and you must be able to stand. There's no imaging in this protocol. However, there is specimen collection, so things again like blood collection will occur. All right, next slide. Very, very similar. Also, a protocol called Neuroderm. Again, it's a double-blinded study to determine the effects of a study infusion drug ND0612 on Parkinson's disease in comparison to levodopa carbidopa, which, as Natalie explained earlier, is one of the medication prescribed to Parkinson's disease patients. So the inclusionary criteria, you need to be over the age of 30. The study period is over the course of 40 weeks. You need to have a diagnosis of Parkinson's disease. Something very specific to this protocol, you must have 4 doses per day of levodopa. So that that leads to at least 40 mgs of levodopa per day, or 3 doses per day of Rotari, which is another type of Parkinson's disease, another type of Parkinson's disease medication. And this as well has some specimen collection, specifically blood collection. Next slide, please. All right, I'm going to move into observational studies. So our first observational study is called Atlas, and this is more open to a wide-ranging patients with mild all the way to advanced Parkinson's disease. It's a longitudinal study that investigates the changes in the symptoms and progression of Parkinson's disease. The criteria is that you need to be from the ages of 30 to 70. The study period is over the range of 3 years. You must have a PD diagnosis within 3 to 12 years, so that allows more people to participate. And you must be on 1 or more dopamine agents to be in this trial. There is some imaging, so imaging like MRI. There is also the possibility of getting PET scans. And there's some specimen collection, so some blood collection as well. All right, next slide. Another observational study is called Ironman. Ironman is a longitudinal study to establish a non-invasive imaging method for measuring and quantifying iron changes in the brain of subjects with PD or REM sleep disorder. The criteria is you have to be between the ages of 30 to 100. Again, allows more inclusiveness of patients with PD. Has a study period of 2 years. You must have a PD diagnosis. It's very similar to Atlas. You need to be on 1 or more dopamine agent, or you could also be naive. So that's something that is a bit different. There is some imaging parts to this trial. There is MRI scans, there is PET scans, and there is specimen collection, like blood collection. Next slide, please. All right, so after talking about all those clinical trials, you may be wondering, how are the subjects who are going through these clinical trials feeling? Are they benefiting from them? So, we went back to our subjects and we collected some patient testimonials, and I have a few written on the screen. So the first one says, I came with an open mind and assumed the best. I had a very positive attitude towards it and hoped something good would come out in the short and long term for me or in the entire Parkinson's community. So the key thing about clinical trials that everyone should be aware is that they may not have a direct benefit to you, but in the long term will benefit the rest of the community. So that's something to keep in mind. Another patient testimonial is, I think clinical trials is going to be very helpful and beneficial to the PD community. It has helped me so far in many ways. My quality of life has improved quite a bit, and I'm getting lots of positive feedback from friends and family. And finally, the last one, I would definitely recommend participation in a clinical trial to another PD patient. I am seeing a lot of benefits to my condition after the clinical trial, and therefore hope the entire Parkinson's community would benefit. All right, next slide. All right, so that is the end of all the research protocols. So we do have 2 more very intensive protocols that we have yet to discuss during our presentation today. We plan to come back and do another presentation that is focused on the type of research those 2 protocols are focused on. So stay tuned for that. Other than that, we want to thank you for participating in our seminar. If you guys have any questions or comments, feel free to write them into the chat box.
So it seems that there's no chat function today. However, if you use the raise your hand function at the bottom right, you can raise your hand and unmute yourself and ask the question. Natalie, can you go to the next slide? I think there's contact information. The next slide.
Yes. There we go.
Yep, so if you're interested in any of the clinical trials, or if you want to talk about Parkinson's disease in a little bit more detail, our research coordinators are here to help you. So for the Atlas, Spark, Restore, you can contact myself. That's my email address as well as phone number. For Ironman, you can contact another research coordinator named Eileen. Her email and phone number is also written for you as well. And then for Neuroderm, you can contact my colleague Samantha. Her email and her phone number is written as well.
In the meantime, I will start the poll.
Kenny, should I stop sharing my screen?
No, that's fine. They
Okay.
should be able to see the poll.
All right, so we just have a few poll questions, basically trying to figure out who's in our audience today, trying to learn more about you guys. So, take your time, answer the question the best you can.
Also, for the raise your hand function, you first need to click on the participants button, and then you will see the raise your hand function at the bottom. So I think we do have a question. Miss Judith, you're unmuted.
That me? I just wanted to ask what is meant by the word naive in conjunction with medications.
Sure, so naive means that you are not or have not been on any medications in regards to your Parkinson's disease. So that means either now or in the past, you have not been on any PD medication.
Thank you.
Okay.
You can talk.
Very good question.
I unmuted also. I unmuted. You can talk.
I believe, Mr. Robert, you have a question?
Pat, you have a question? He's asking.
Is that Muriel? Do you have a question?
I think Miss Patricia has a question.
Yes, hi. Thank you so much for the presentation. I've participated in a few clinical trials and I think they're fantastic. I just wanted to know if you have any idea how long the MRI portion of any of these trials is, because that's one of my, it's not fun.
Sure.
I mean, they don't hurt, it's just that after a while you get a little bit claustrophobic and it's like little jackhammers hitting your hearing.
So usually for most clinical trials, for Parkinson's as well as Alzheimer's disease, the MRI part of the protocol is meant for safety. And what I mean by that is that the MRI is usually done by standard of care. So it's usually just an hour, your normal MRI. You go into the scanner, you do the scan, and you come out. It's very typical, nothing out of the ordinary, unless that specific protocol has something that is research based on the MRI, but that is very actually uncommon. Most of the time, the MRI portion is just safety, standard of care. We just want to check to see if anything is going on, so we do a MRI scan.
But they're typically an hour, is that right?
Exactly. Yep.
Yeah. Thank you.
Yeah.
Yep.
Start to finish, right? And by safety checks, right? You go in. It's the process that they're going to ask you all the questions again about: do you have any metal? Did you take all your jewelry off? Changing into the gown, getting into place. The magnet is off. They step away. So the whole process. Ideally, you're not actually in there with the electrons firing away with that loud noise, right? They do try to minimize that part, for the sake of one's comfort. But roughly start to finish, right? It's roughly
Great.
an hour.
Thank you.
Any other questions?
There's also going to be a recording of this presentation, and I'll be sending out the link to our YouTube channel later on. And then you can watch the recording for contact information or if you missed something. We do have one more question, I believe.
I think Kay raised her hand.
Hi, I'm trying to submit this poll and it's not going through.
That's okay. I think as long as you have pressed a couple of them, the questions will be submitted.
Okay.
The answers will be submitted.
Yeah, it might take a moment right on our screen to repopulate. I see we have a couple that already answered. Oh, we have from Queens, I see. Very nice. We have somebody from New Jersey.
And I also do want to interject. So I know sometimes, transportation to our site can be a little tricky, especially with, the protocols involving multiple visits. We are working with the APDA, which is the Association of Parkinson's Disease, to offer transportation assistance to our research subjects. So in case where you are interested and you are having trouble coming to your visit, there is always a way to maneuver that and figure out a solution. So I just wanted to throw that out there, just in case you are worried about getting here. There is ways to help you.
We also try really hard to be aware of everyone's busy schedule, right? We know that between exercise classes, physical therapy, family commitments, some of you are working, doing other things. So we try really hard to accommodate schedules to really make it as flexible as possible. And even now, right, we're still limited with our social isolation during the pandemic. So we have our safety protocols installed. And of course, any data that can be collected ahead of time, you know, we will work with you on that. And the slides today that we shared, it's a summary, right? It's a short summary of what the study really entailed. So if something piqued your interest here, just get in touch with us, and then we can have that extended one-on-one conversation regarding, you know, more detailed questions, and if something may be a good fit for you. And in some cases, a person might be a good fit for multiple trials. And of course, nobody should be overburdened by doing too much, but that's also part of the ongoing conversation. And I think one of the challenges with just, you know, I myself being both a clinician and a researcher is that in the clinic, we do get so busy talking about all the health issues and, you know, whether it is time for medication or medication change, or, you know, doing the refills and making sure everything else is aligned and knowing that physical therapy is in place, right? So all of that makes for a very busy clinic visit. And oftentimes we get like a minute to talk about research. And so we do want to make that channel more available for everyone who's genuinely interested. So this was one of our ways to reach out to everyone. And if you like this sort of format, doing a webinar style where we offer the information, we are definitely happy to do it again in the future. So like Mesa mentioned, the precision medicine, you know, that has a big role in today's current, you know, healthcare and research transformation. So we can definitely share more, including some of the other trials which have a lot of details to them.
If there are no more questions, we'll finish the presentation in about 1 minute. So if you have a question, please raise your hand. In terms of the poll, one of the things is that you will have to answer all the questions before you can submit the poll.
Kenny, thank you for clarifying. Maybe that might have been the issue. So all questions, right, have to be answered.
I think so as well.
In order to submit.
Mm-hmm.
And for those who selected other concerns regarding clinical trials, I think we could have a meeting on that alone, because it, again, for me as a researcher, it's always interesting to hear what are some of the reservations that a person may have before enrolling in a trial.
So it seems that we don't have any questions. Thank you very much, Natalie. Thank you very much, Mesa, today. Thank you very much, everyone, for attending today's presentation. Muchas gracias por atender la presentación el día de hoy, and have a good one.
Thank you, everybody. Have a good day.
Thank you.
Bye-bye.
Bye.
Thank you, Kenny. Bye-bye.
Thank you. Bye-bye.